this is Minda Wilson with Urgent Care. Today I have the great honor of introducing Dr. David Mayer, the new president of the Patient Safety Movement. He is a very accomplished physician and in his own right, and leads an amazing movement that's dedicated to zero preventable deaths by 2030, which is an amazing goal. Welcome to our show.
Well, thanks, Minda. It's really an honor to be on with you today and hopefully share some of the mission of the patient safety movement. I think you did a great job of teeing it up there for us.
So tell us a little bit about yourself. So what led you to medicine and how did you get interested in it?
I didn't come from a family that had anybody in healthcare, yet I always had a like for it. I wanted to be part of taking care of patients, and I guess I had some role models of physicians I went to that I was very impressed with when I was young. And it just seemed to be the right calling for me, and it really was. I just loved my career. I'm not in the clinical operating room anymore. I was a cardiac anesthesiologist by training, but I wouldn't have changed it for anything. I love taking care of patients, from babies to the elderly, and I had a passion about quality and safety all along. My parents were in the business side, and they always tracked statistics and outcomes and how they were doing, and I wondered why we weren't doing that back in the 80s and 90s in the way we took care of patients. And so I always had this sort of passion for quality and safety in healthcare.
You're in charge of it for the MedStar Institute, as well as running the patient safety. So you have a deep knowledge of it. What attracted you to the Patient Safety Movement Foundation?
Yeah, when Joe Chiani, the founder of the Patient Safety Movement Foundation, back in 2012, got the organization going, I was drawn to it because there were two things that I found refreshing. The first was Joe had a sense of urgency. He just didn't want to, as we like to say, lecture and PowerPoint this away, which many of us have tried for years and hasn't worked well. But Joe was taking a different approach. It was something that I found refreshing. I used to love going to IHI meetings and Don Berwick and listening to Dr. Berwick, and he was just so moving, and Joe had that sort of urgency the way Don had it at the meetings when he ran the IHI. And so I found that urgency of making change really enjoyable. And then the second thing was Joe's mission was always around the patient and family voice. He brought that to the organization from the start, and it was just something that I've been very passionate about. I've always felt that patients and family members have to partner with us and work with us together to solve the quality and safety issues that we face today in healthcare. And when you put them on committees and you bring them into the conversation, it's been so refreshing. And those two things, the urgency and making sure that the patient family voice was right in the middle of everything we did.
And it creates alignment,
It does. It does. It really, again, talking about Dr. Berwick, I love one of his lines where he said, patients aren't visitors in our lives. We are visitors in their lives, and we need to respect that, their goals, their values, and what they're trying to achieve with their care. It's not what we think is right. It's what's right for them, and they need to, share that with us so we do it correctly. So I loved that Joe brought the patient family voice in right away. And when he asked me to serve on the board when it first started, I said, yeah. So I've been on the board for probably nine and a half years now. And then a year and a half ago, 2 years ago, he asked if I would take over the CEO position from him, and he wanted to step back. He's still very active with the organization, but he wanted to just spend his time in a few other things. So I graciously was honored and said, yeah, I will take over that CEO role as long as you stay with the organization. It's been a great partnership.
So the thing that's interesting to me is that the medical system and the patient and the patient's family, their goals are totally aligned. Everybody wants optimum health for the patient. So by one of the things that the patient safety movement does by creating this collaboration is bring the knowledge of both sides to each other. Nobody understands the patient like the family member, and nobody understands the medical part like the doctor. And I think that's one of the. So, do you think that's true, or do you think that that's just the beginning of what makes this work?
No, that's very true. And I totally agree with you. I will tell you, I've learned more about how to provide safe, high-quality care from patients and family members than I have from many of my colleagues. The patients and families see things from a different side that many of us in healthcare might not appreciate, and that's why you have to bring their voice into all the work we do, whether it's a event review for something that might have happened that didn't go correctly, or something that worked very well. We need their input. We need their guidance to help us if we're going to achieve zero preventable deaths by 2030. I think much of the country doesn't realize that while we do tremendous things in healthcare, we're curing cancers we never thought curable 10 years ago. You're having procedures done in your home within 2 hours that you used to be hospitalized for 7 days. But it hasn't come without a cost. And sometimes humans make mistakes or systems don't function the way that they were intended to, and people get harmed. And medical harm and medical deaths from preventable errors are the third leading cause of death in this country. And a number of research studies have confirmed that behind cancer and heart disease. So we all have to work better and find the right solutions and systems that make healthcare safer. No one goes into healthcare to harm somebody, yet we unintentionally have these events happen all too often.
And one of the things your organization done and has done well is sort of identify some of the preventable causes of harm and death. And then, so what are some of the key things that people who have loved ones who may be in a hospital setting should be aware of when they go into the hospital?
Well, a couple things, and you're exactly right. We have 37 what we call actionable patient safety solutions. These are research and evidence-based tools that bring all that together. So around medication safety, around hospital-acquired infections, and the Patient Safety Movement Foundation provides these free to hospitals. They also have a wonderful app that is free to patients and family members. It's called Patient Aider. And what it does is allow you to know when you're going into a hospital or you've got a certain condition, what are the things you should be asking? And I think communication is so key. Many times patients hear something from a physician and they're overwhelmed by a care plan that's being proposed, and they don't remember it all. So we always tell patients to bring a family member, bring a friend with you, and not only what we call write down, but then read back what you thought you heard the physician or nurse say. Was it take 2 pills once a day or 1 pill twice a day? Those things could be forgotten by the time you get home, even with the labels on medications today. So bring a family member or someone that you trust to be there to help you with your decision making. I think when you're in the hospital, also have somebody there with you that's confirming with the nurse, the physician, about when your medications are supposed to happen or what tests you're going for. Those types of things, and just ask a lot of questions. Just if you're unsure, take the extra time and say, could you explain that to me again? Because I'm not sure I'm understanding what you're telling me. We see so many breakdowns in mistakes or errors that are made because of communication lapses. We think we heard something when, in essence, we didn't hear exactly what was said to us.
So so with COVID-19 sort of entering our daily lives, and people being at home, are some of these practices able to be maintained when people go home? So if they have that application.
Yeah, it's been very challenging. It's been very challenging. Many of the hospitals have gone to, using telecommunication type devices, iPads, iPhones, whatever, to keep the family connected with patients, especially at the early parts of the pandemic when, hospitals were not allowing any guests or visitors in. And so we have to figure out ways to do that effectively. And it's not as effective. I Zoom meetings now, and I'm doing all these things virtually, but there's nothing like being in the room with your loved one and with the clinical care team and trying to understand. So it makes it even more important that we're asking questions and we're confirming and validating what we heard or what the instructions or care plan that we've come together has been heard by both sides.
So so in terms of access to data, patient data, do you feel that open patient health records are creating a better environment? So, PHRs, some of the technology to sort of communicate with people so that they can access their data?
Yes, I'm a big believer in components like open notes and other forms that allow a patient to access their records and to see them when they're in the hospital or even when they're not in the hospital. We find so many times things are put into a medical record that a patient will point out that, hey, this isn't correct. I'm not on this medication anymore. I haven't been on this medication for 2 years, and yet it's still in my record. It still says I'm taking it regularly. Or sometimes I never had a hysterectomy, and in my chart it says I had a hysterectomy. Mistakes are made, and having the patient see those records and able to point those things out to us can eliminate a potential mistake made later on. So I think it's wonderful when patients truly, embrace the record and follow it and make sure it's correct with us.
So do you feel technology is making it harder or easier for communication with patients?
Both. So that's sort of like the double-edged sword, so to speak. Look, electronic health records, and there's a great researcher, Raj Watrani, who's part of the National Center for Human Factors Engineering at MedStar, has studied the electronic health record and has pointed out that while it does make a number of things easier and allows us to move forward, there are so many system and process issues with the EHR that lead to potential mistakes or errors in treating patients. And so it's moving us forward, but we've got to make sure it's moving us forward in the correct way and that we're not taking one step forward and then one step back, because it's creating more potential errors and mistakes in a patient's record.
So if you could give patients 3 recommendations of what they could do to reduce the likelihood of errors, the top 3 things you would say in this environment, what would they be?
I would say first, as we talked about, bring a family member or a friend with you on your appointments, as well as if you're in the hospital, make sure that you've got somebody today, if it's through technology or visiting restrictions are being lifted in many parts of the hospital. Make sure you've got that person there to validate, verify what you're hearing. I'd also take a recorder many times and record the conversation. So when you go home, you could re-listen to it to make sure that you did hear things correctly. So that communication is important. Second opinions many times are extremely valuable. If you're going in and you're going to have a procedure or an operation, sometimes it's just good to get a second opinion about, is that the correct treatment plan? Today there are multiple different options based on minimally invasive or just rehab and facilities versus knee arthroscopies. There are different options, and everybody needs to be aware of all those different options. So a second opinion sometimes could open up ideas that weren't presented by the first care team. That's very important. And then finally, just ask questions. Don't be intimidated by a doctor and nurse who seems to be in a hurry and wants to, move to see the next patient. Take the time to ask the questions that you need asked. It's your health. You own that, and you need to make sure that you're getting your questions answered. So don't hesitate to say, wait a minute, could you just take another minute and explain that to me again, because I'm not sure I'm understanding what you're telling me.
So how important is the patient advocate? Like if the patient is unable to, is too sick to advocate for themselves, do you recommend somebody having a family member that advocates for the patient? What would that role look like?
Well, I'll give you a true case. When my wife was in the hospital, I stayed with her 24/7 for the 2.5 days she was there after a procedure. I just wanted to make sure that, she was comfortable and that she was getting the medications that she was supposed to get at the time she was supposed to get it, and they were the correct medications. So if a nurse would bring medication in, I would ask the nurse, could you please confirm with me what you're giving my wife, because she's sleepy. She can't ask those questions many times because hospitals are not places where you could catch up on your sleep. We're always waking you up and asking you questions or taking your blood pressure or giving you a medicine. And every patient gets tired. The procedure they had makes them weak in the recovery period. And so having that person at the bedside with you to just validate and verify your care plan is proceeding the way we all agreed and without any mistakes or lapses.
So what can somebody so if the patient safety movement is a really important organization and everybody at some point in their life is going to be a patient. I mean, there's no getting around that. So how can people participate, access this information? How do you recommend that they reach out to you?
Well, the best way to reach out to us is through our website, Patient Safety Movement Foundation website. We have a number of, like I mentioned, tools for not only hospitals and caregivers, but tools for patients and family members, things that they could use to take with them. That Patient Aider app that could be downloaded on your handheld phone or iPad is a great tool, and it's free. And if you had it on your phone and you were going to see a physician about a potential procedure, using that Patient Aider app would give you a lot of background information and the types of questions you would want to ask. So I would encourage people to go to our website. We are a volunteer organization. We are made up of over 500 volunteers who do this work out of, their kindness. Many who work with us, who volunteer their time, are families who've lost loved ones due to preventable medical harm or have been injured due to preventable medical harm, and they want to give back. They want to make life and care safer for others, so the same unfortunate event that happened to their loved one, either was undetected infection that led to sepsis, and then by the time it was diagnosed, it was too late. We've had things where biopsies have been lost and patients didn't know they had cancer for 3, 4, 5 months after the biopsy, and treatments were started later. Those are the types of things that continue to fall through the cracks. And our website and our foundation strives to help not only the patients and family members, but also the care teams in hospitals all across the world with these free tools.
And you have speakers who you have these people who act as, who've had these experiences, who act as speakers, who will come out and help educate people on what they can do as well.
That's totally correct, and I'm glad you brought that up. On the website, there's numerous videos of people sharing stories and helping to educate the public on what they would have asked, knowing now what they know now versus what then. And so just to watch some of the videos and the discussions, each week we have 2 or 3 webinars that come right off the website that talk about, how to manage infections and things you should be looking for, early warning signs, if you're starting a new medication, things that you might want to know as you start taking that medication. So yes, a lot of tools and videos that are very educational and we believe are helping save lives.
Yeah, because the truth is, if you're not the patient, if you're a family member or a loved one, and your loved one is having a health crisis, there's an emotional component that where you're suffering too. I mean, it affects you. And when you're in that emotional place, you're not always appropriately hearing what people are telling you about what's needed to care for your loved one, or actions you need to take, or medications, or whatever. So your suggestions about writing things down are important. Having an independent person is important, but also recognizing where you are emotionally. So if you can ask somebody again, to repeat something, there's no shame in that. If you don't understand something, there's no shame in that. All of that is important in the interaction, especially now that doctors spend less time interacting with patients.
It's so true. I think you just summed it up extremely well. I'll give you a quick story. There was a surgeon. A woman was referred to a surgeon for a pretty large procedure, and her husband came to the office with her to hear what the surgeon was going to recommend. And the surgeon started the conversation by saying, "Would you mind if I put a tape recorder out on the table so we could record this?" And the initial reaction by the husband was, "Oh, this must be a physician that just wants to, record it for his own safety or fear of litigation or something." But they talked for about 20 minutes, and then the physician turned the tape recorder off. He took the tape out, and he handed it to the couple and said, "Look, I know this is very emotional, and I know a lot of things we talked about today you probably won't remember when you get home. But I want you to take this tape, and I want you to listen to it tonight. And I want you to share it with other family members if you have questions, so they could help you in your decision-making as we move forward." I thought that was wonderful. I thought that was a great example of how to reduce, to your point, when you're hearing things and you're being referred for a procedure, or you've just been told that you have cancer, our minds are just not focused on what is being told that moment after we hear these news types of events. And so I really believe in tape recorders and write down, read back philosophies so that we truly know what that plan is.
And in terms of medical devices and their uses and safety and safety issues with that, patients are taking more responsible for their own care outside the institutional setting. So how do you suggest people deal with that? Home dialysis is we're moving towards even home dialysis, or we're moving towards, a lot of things that used to be done in a center or a hospital. We're doing them at home now. So how do you suggest people make sure that they're safe when they're doing these things at home?
And that goes back to the asking the questions and doing the background research and understanding about what is going to happen at home. We are truly sending patients home sooner than we ever have. We're trusting either home nursing, which does a good job, but many times a good friend of mine, Marty Hatley, who's a nationally known patient and family advocate. He's been doing the work for almost 25, 30 years in patient safety. He describes that really the term caregiver now applies many times to the family, because they are providing the care at home that's necessary after a procedure or dialysis or whatever congestive heart failure type illnesses. The family is become more and more the caregiver outside the hospital. And so I think it's very important when we use the term caregivers, we understand it could be the doctor, the nurse, the therapist in the hospital, but many times it's the family at home, and they need to really understand what that means, and we need to prepare them and educate them so that they do know how to change a dressing after a wound or a surgical procedure and do it correctly. They need to know when to give the medications, at what times, things like that. So, yes, healthcare has really been moving quickly out of the hospitals.
But some of the procedures that you have on your website are applicable at home. Some of the cleanliness recommendations certainly are, have to be done in the home to keep the patient safe. Some of those things have value, even if they're not in a hospital.
That's correct. There's a lot of those tools and resources that are available for families to understand how to change an IV port, connection, and do it safely, and do it so that there's no risk for infection. These are things that families have not experienced, having to do these things 20 years ago, and we're now relying on family members, as I said, to be a big part of the caregiver team.
Right, and early signs of infection for early intervention, or some of those things. People, the ability to know what to look for, and all of that is tools to help support that are available through your application.
Correct, through the website and all the different apps. I mean, you bring up a great comment where you're looking at an incision after surgery, and and you look and you see it looks a little redder than it was. Well, take a picture with your cell phone and text it to the physician or the nurse practitioner so they can see. If you have any doubt, do those things versus, I'll just wait because I know we're going to see the doctor in 2-3 days. No, act on those things. That's an example of where technology can be a benefit.
Right.
To letting the physician and the nurse know that, the wound is a little redder than we want or would think would be, and let's get into the office and have it checked out. Or, no, that's really fine. I don't see anything, but I'm glad you reached out and sent me that picture. And so far, all looks good.
Right. And it's also important that family caregivers know the value of complying with caregivers at home. You're at home, you've had heart surgery, they're concerned about you retaining fluids. They're saying weigh yourself 5 times a day, and maybe your loved one doesn't feel like getting out of bed to weigh themselves. Well, make them.
Yes. Make them get out of the chair and walk a little bit every day. We don't want to get, deep vein thrombosis, all those little things that family members have to now be doing for their loved ones at home to ensure that their care stays safe and they don't develop any secondary complications or other issues related to the procedure they had.
So if somebody wants to reach out to the patient safety movement, learn more about it, maybe are you funded? Are you funded through donations? How do you raise your money?
Yes, we're funded through donations. We get a number of our funding supports come from healthcare companies who believe in our work and want to see healthcare safer. So they contribute and do a wonderful job. We just had an event. It was Unite for Safe Care on World Patient Safety Day, September 17th. And it was an event that over 10,000 people tuned in and watched. And that event, there was a lot of ideas and education and awareness and sharing to the public about things that they could be doing. And we generated a lot of support and donations through there because people thought it was a wonderful program. The cause was an important cause. And so they gave $5, $10. So we try to, continue to raise funds to support our mission because, like I said, everything we put out there is free, and we provide it free to patients and families, and we provide it free to caregivers, hospitals, and health systems around the world.
Right, and the life it may save may be your loved ones or even yours.
Exactly.
So again,
through those applications I've talked about, we've estimated that hospitals have saved close to 300,000 lives over the last 10 years by using evidence-based tools and resources that are out in the literature.
Yeah, it's amazing. So if people, again, want to reach out to your organization, what's the website they should contact? What's the best way? Yeah,
it's the website, www.patientsafetymovement.org. And the other one is if they just Google Unite for Safe Care, it will take you right to our website as well as the programs that we've been running. Because it's not just patient safety as the pandemic has exposed, it's caregiver safety too. There's way too many caregivers that suffer and have gotten infected and have died from the pandemic and from COVID while taking care of patients and doing what they love doing, that's trying to heal. And so we've got to protect our caregivers as well as our patients and family members, and that's really our mission. If you don't make the work environment the safest possible for those who work in it in healthcare, it then becomes really challenging to make the environment safe for our patients and their families.
So you have a dual mission, which is, it sort of feeds on itself. Keeping the patient safe helps to keep the caregivers safe. Keeping the caregivers safe helps to keep the patient safe. It's one feeds the other.
It has to. You've got to, provide support, and you've got to ensure safety for caregivers. There are so many things that, the burnout rates and the suicide rates of caregivers is higher than the general public. And the pandemic has only made that worse. And so, yes, we need to find ways to protect and really take care of our caregivers at a better level than we have. And if we do that, it will also have an impact on the safety of our patients.
And part of that, helping that, is empowering people to understand and feel confident in what they do. If they feel they're doing a good job and the best job they can possibly do, they feel good about themselves, they feel good about the work. So giving them tools like you have empowers people to feel better about themselves. And even in a situation where the patient may not be doing well, if they know they're doing all that they can, they feel good. If they're uncertain about what they're doing, then that leads to the stress. It leads to the emotional issues. Don't you think?
Does. And yeah, it does. And we've seen that, long work hours, the acuity of the patients that one nurse may be taking care of. All those things create a lot of stress that just makes the chance for making a mistake greater. If we're tired, if we're stressed, if we're not really thinking the way we should be thinking, those are things that have been shown to increase the potential of making a mistake and potentially harming our patients.
True, so true. Dr. David Meyer, thank you so much for coming on our show. If you're interested in the tools that they have available or helping to support the organization or arranging for someone to come and talk to you, it's www.patientsafetymovement.org. And this is Minda Wilson for Urgent Care.